Hey everybody, Dr. Shook here. In this video, what I want to do is talk about inflammation with you, okay? So when we talk about inflammation and its impact upon thyroid physiology, there's a lot of things that it can cause to go wrong. So one of the first things that we'll see with high levels of inflammation is that it will cause you to have a problem. It can disrupt the efficiency of the neurological signaling from your brain to the thyroid. Okay, so that, remember, if you watched the video that I created on, it's a whiteboard video on understanding the thyroid physiology, how it's produced from the brain and then all the way to the thyroid hormone being produced and then being delivered to the cell. Because remember, that's what the thyroid hormone does, is it stimulates every single cell in our body, the physiological function. If you watch that video, you'll know that the process begins in the hypothalamus, a central structure in the brain where it releases this hormone called TRH, thyroid releasing hormone or thyrotropin. Okay, so TRH stimulates the pituitary gland, which is also a brain structure, to produce TSH, thyroid stimulating hormone. And remember, thyroid stimulating hormone is the hormone that's commonly checked by your doctor to see to get an indirect measurement of how your thyroid's functioning. So the TRH stimulates the pituitary. The pituitary gland, also a brain structure, makes TSH, and the TSH stimulates the thyroid to produce thyroid hormone. Okay, that's the brain signaling to the gland. So this would be called the hypothalamic pituitary thyroid axis. Okay, this feedback system, this hormone production system. So increased inflammation will cause issues with that signaling. It can cause disruption and cause suppression of some of those hormones being produced, and actually result in you not making enough thyroid hormone just due to inflammation. Okay, so that's one thing that we know about inflammatory processes. So understanding that inflammation is important is really important for you clinically, because you can have a lot of symptoms of hypothyroidism, but your levels be perfectly normal, your quantity of the hormone be normal, and everyone be scratching their heads and just thinking, well, what do we do? Everything looks fine, and sometimes that leads people to their doctors because they don't understand that physiology, or they're not aware that that can happen. They end up prescribing more hormone, thinking that's the answer, or just telling you that there's nothing else that I can do, and then you as a patient being left still feeling bad. So that's really important to understand. That's one thing that inflammation can do. It can suppress that hypothalamic, pituitary, and thyroid axis, so that feed forward system, the brain producing the hormones to signal the gland to make enough to produce thyroid hormone. So there are patterns that we can pick up on blood chemistry when we look at your TSH levels and your quantity of thyroid hormone to give us an idea if that might be something that's occurring in your case. And then also we would look at your inflammatory markers. C-reactive protein and homocysteine are reasonable for us to look at. And then we also consider if you're autoimmune, there's inflammation produced as a byproduct of that. So anyway, just want to share with you inflammation and one of the effects on thyroid hormone. There are a few other things I want to talk about in another video, but I don't want to make this one too long. So stay tuned maybe for a video tomorrow or the next day. I'll share with you guys some other impacts of inflammation on thyroid hormone chemistry. And this is a reason. These are reasons why you might have normal TSH levels or normal thyroid hormone quantity, but you still have symptoms. Okay, Dr. Shook, I hope you guys have a wonderful day. Thank you for tuning in and to learn more about your health.